Well, it is the issue Governor Eric Holcomb says keeps him up at night. Now he's hoping an expansion will reduce his fears. Today, the governor announced more counties will start a drug treatment program. Indiana Statehouse Bureau Chief Nick Natario joins us from one of the sites to explain how this might help.
This is one of those sites where more help is coming. Governor Holcomb spoke here at the Johnson County facility and was emotional as he addressed this issue. Addicts sitting in the room were emotional too because they know the stakes are high to fix this problem. A packed room sat silently as Amy Reardon shared her story.
I would go 3 days and I would be so incredibly sick that I could not function. I couldn't go anywhere. I couldn't do anything.
The Indianapolis woman spent 10 years abusing drugs, an addiction she wants to beat.
We just want to work and we want to be part of the population, and we just want to go and get our treatment and live our lives.
A plea that hit an audience member hard.
Amy.
As Governor Eric Holcomb held back tears and stumbled to speak.
Seeing the sunrise and people going to work in the morning, getting their life back, having light shining down in what may be an individual's darkest hour. This is a day of encouragement for us all.
Encouraging because he announced plans to add new treatment programs at these places across the state, a program Reardon knows well.
I'm not spending every day obsessed with getting drugs and where are they at and being mad if I can't get them.
Here's how the program works. Patients visit a clinic where they can get education, counseling, and medication, a drug that provides a safer option. Right now there are 14 programs across the state, and last year more than 10,000 people used them. Not only are more coming, but next month Medicaid users will have access.
This is how we combat an opiate epidemic, by putting people first and embracing the integration of science, data, and compassion.
An expansion Governor Holcomb ties to the rising sun in the state's seal. A new day Reardon hopes is coming.
This is going to be huge. It's going to open treatment up to so many people that didn't have access to it before.
It's still going to be several months before these sites are ready to go. They're going to have to hire and train staff. The goal is to have these 5 programs running by the end of next June. Indiana Statehouse Bureau Chief Nick Natario, 24 Hour News 8.